Namaskaram, welcome to Aware and Care, your favorite Ayurveda program on the social media, giving us information and the comfort of our house, giving access to doctors and remedies in our kitchen, but of course, always with consultation first. I'm Madhavi Bathula, always happy to introduce Dr. Ambika Nair to the show. Namaskaram, doctor.
Namaskaram. How are you?
I'm doing very good, doctor. Our co-founder and chief consultant of Santhigram group of companies has become very, very busy because of Aware and Care. And it is a delight for any doctor to know that the information that she or he is sharing is getting across to the medium and to the right person at the right time. We thank our community for giving us their love and support for this program. One person at a time, one patient at a time, one remedy at a time. That is the mantra, so that the information goes to the right ears. Dr. Nair, excitement is there about spring. And the other day I was talking about snow and rain. We are talking about all these weather conditions and external conditions, sometimes depending on it, sometimes blaming it for something that is happening internally. In the series of mental well-being and the series of depression, we have covered a couple of episodes. Today, we want to understand when you talk about body compositions, Vata, Pitta, Kapha, let's talk about Vata-related depression. What is Vata? Let's understand that and then understand the problems associated with it.
Okay, very good. Okay, thank you. Absolutely. Topic is very good.
Okay.
Actually, it is type of energy, that is made of air and ether. And is linked with the movement and creativity and impulse. They are very creative. Their mind will be running always. That's why we call them, like Vata. Vata, anyway. Okay, so, Vata, how can you identify a person? I'm going to tell you that. Okay.
Sure.
Vata type person is usually either small in, like in their, appearance, they will be little small body frame. Sometimes they will have very heavy body frame also. Okay. But, like heavy in the sense, not that like kapha, they'll be very tall, very tall.
Okay.
They have like a small eyes will be there. They are delicate, very thin skin, frizzy hair. They will not have very heavy hair. Irregularly shaped teeth, that you can always see. They tend to be affected, by the sun rays and all. They get aggravated with, like if you provoke them for anything, their aggravation will be too much. So, they are quick-witted, they will pull the crowd first.
Wow. Okay.
Very nice people actually. But, like they like environment and all. They are very creative, enthusiastic, very enthusiastic in everything. They like music, they like dance, You can see those people, when they sit and they will be just on movements, either shaking the hands, shaking the, legs and all, this type of people are like that. Yeah.
So, doctor, when we are talking about such exciting features for Vata-related body composition, where does depression fit in? How can somebody who is having so much of energy, so much of excitement, so much of creativity also feel depressed? And of course, like this program is all about debunking the myths and misconceptions related to depression. Can we understand how does a person with this body type feel when you have to diagnose, or how is diagnosis done?
Okay, if everything goes smoothly, they are well balanced. Okay, so if any imbalance, like Vata Dosha, governing the body are out of, synchronization, okay, it cannot, then the individual tends to be very agitated. They walk off from they put the resignation, in the offices and all, they do like this. They will have low back pain, moving pain, like all the crackling in the joints will be there. Very poor digestion, very dry skin. Very emancipated, very much anxious, fearful, and their neurological and psychological issues will be in a very, very aggravated mode, actually.
Okay. So, friends, what you just heard is about when there is imbalance. Whenever a doctor or a talk show happens, it's not only about Aware and Care, any talk show. Please do not pick bits and pieces of information and stick it on your body and say that this is me. There is always a complete body diagnosis and mental diagnosis which is done before any kind of treatment is done. These are not generalized statements, it's this individual specific. So please go for consultation before you pick any home remedies. Dr. Nair, we have to give this advice to our viewers, because we are so excited about all the information that we receive that we just want to randomly pick something and then say, you know what, we heard this on a television show or an OTT platform or on social media. So when we're talking about Vata and we just spoke about imbalance, I'm a bit confused now. There is so much of excitement. Life also gives you lots of disappointments. So when a Vata related person faces disappointments, are we talking about all these related symptoms? What kind of other symptoms does the person feel apart
See,
from,
some people
backache?
with IBS, irritated bowel syndrome, when the imbalance comes in, anxiety leads to a lot of hyperacidity. Then, hyperacidity, when that person, when they eat, poor digestion, already I told you. So, it leads to a irritating bowel syndrome. When they eat little bit, they feel like going to the bathroom. So there are so many other
Connected.
diseases also connected to that actually. So
Wow.
much of gas formation, hyperacidity. They will tell that, that acid reflux is also, this is all related actually.
Wow. So never did we think that, a health bodily condition, which is again not a mental condition, but not also body condition. There's a balance between them and some imbalance which happens. So if you're having IBS or if you're having body aches and if you're having itchy skin or something, there is a possibility there is something that is stressing you up, bringing anxiety. And that's what we are talking about, Vata related depressive disorders that a patient is facing. So Dr. Nair, what age group of people usually you see that this imbalance is more, or it can happen at any age group or any gender specific?
Yeah, very good question. I had a very small child, like a 7-year-old.
Wow. Okay.
Because he had a atopic eczema. He was little asthmatic also. This child never used to sleep. Insomnia is very, very common in this condition because they cannot sleep. See, when you don't sleep, you will get emancipated and you get irritated. So, that was a 7-year-old I have seen like that. And treated successfully.
Fantastic. So we are saying this age group is not a limit. The imbalance could happen because of any reason.
Yes.
So Dr. Nair, is there any external conditions that lead to imbalance in Vata? Is it always in?
Like skin dryness will be there. They get agitated. They have the destructive mentality also. You understand?
No, I was just
jealous.
Checking. Yeah, I was checking basically maybe like a weather or social pressures.
Weather
or,
is there. Coming to that. Okay.
Okay.
Weather change. See, if you are like they will love California weather. Like a sunshine a lot. But if they come to this New Jersey and New York and all, they will never like it because it's always cloudy. This is kapha weather over here. You understand? No?
Okay.
Okay, that's why. Little bit of, like to take care of ourselves, like weather changes has to be taken care. But sometimes some people, they are forced to work in certain conditions. Some loss in life. Sometimes it will be genetic also.
Oh, okay.
Even hyperthyroid. I have seen like patients. Like it's any other, like loss.
Okay. So there are a lot of factors.
Loss, like your economic, like financial losses.
Financial
and anybody can become, like even Vata Kapha is also there, Vata Pitta is also there. But in extremely Vata, it will be like that. Their mind is always running. Yeah.
So Dr. Nair, is it possible that somebody who's facing a Vata related health condition, or here when we're talking about mental well-being, after a certain point in life, he or she also is facing a Pitta related, can the shift happen at any point in life, or it is like only Vata means only Vata related
No.
conditions?
It can be taken care with the Panchakarma very nicely.
Okay.
Very, like this all can be treated very properly actually.
Okay, let's go towards the treatment options.
Like a diet. If you are eating a lot of, like potatoes, cauliflower, broccoli, cabbage, Brussels sprouts, kale, and like eating uncooked food a lot, so much of potatoes, so many things, high spice, all those things can cause, because diet is also more important in Vata. We have to give them a very Vata pacifying diet.
Okay. So cruciferous vegetables are a no. Is that what you're saying?
Yeah, in this case, we will tell them not to eat all those things. Because whatever causes, Madhavi, whatever we eat, it should digest and assimilate, nourish our body. But here it become a poison for us.
Wow. So if I like cauliflower too much and I eat too much of it, I have to definitely observe and understand what is happening. It same
No,
applies
no,
to
no. It's
potatoes, or
not. It's
it's
not
not
like
like
that.
that.
If you
Okay.
eat, if you have any hormonal imbalance, or if you have any problem after eating it, if you feel like, like a bloated abdomen,
Mm-hmm.
burping a lot and all, then you
Mm-hmm.
should know that your digestion has not taken place properly. Then you can, this is all using your own wisdom.
How beautiful is this body that it gives you an instant, it's an instant doctor, and it's also an instant healer. And that is
Yes.
what all Ayurveda is about. It is makes us and helps us to recognize this body that functions 24/7 until the last breath. A skin cut gets healed on its own, nails grow on its own, any kind of even mental health and well-being also, it has its own healing system. We just have to support it through right diet and exercise. Dr. Nair, let's quickly understand treatment options at Shantigram.
Treatment options will be Panchakarma. First of all, we will have to counsel this person.
Uh-huh.
Okay, we have to give them Sneha Panam, like like a ghee preparations, with the infused herbs will be given to them.
Uh-huh.
Okay, which will pacify them, pacify the Vata.
Okay.
Then Shidodhara is given, Abhyangam is given.
Uh-huh.
Okay, even Vasti will be given in certain cases.
Mm-hmm.
If like a chronic constipation and all, because it all depends upon person to person. Some days Shidovasti, but it all, like some days it takes 3 weeks, sometimes even it can take more time also. All depends upon the condition of the person.
Right.
Very
Okay.
bad condition means we have to, anyway, but patients are doing very well actually after. Not only, with Santhigram, anywhere if they go and take the proper treatment, it can be taken care. And
Absolutely. How
diet
beautifully
is
said.
more important actually. We have to tell them, only our khichdi is the best, I should say. With very
Okay.
less spice, you can give, like a little rice, more rice, little,
Mm-hmm.
and,
Mm-hmm.
little lentils can be used over there.
Uh-huh.
Vegetables, cooked vegetables, cumin seeds, turmeric,
Mm-hmm.
ghee, everything. If you cook it in the proper way, that will nourish them like anything. It will pacify them. And some herbs are also given so that their mind and body will be aligned in the proper way. They will
Mm-hmm.
sleep well. They will think well. Fear goes away. It's
Mm-hmm.
amazing, actually.
How beautiful. I see so much of positivity of the thought process because as I'm listening to you, I do understand that what you just mentioned earlier, weather conditions, whether it's California or New Jersey or the tri-state, it's completely different. But due to your livelihood, you have to live in different conditions or different situations in life. But if there is some deficiency happening because of these external factors which are not in our control, especially weather, Dr. Nair has just suggested there's a lot of things that you can do internally, starting with your diet. Apart from that, I'm sure Dr. Nair exercises, meditation, good talks, and good walks, and a good movie will definitely help.
Everything will help, but in this Vata cases, they will not focus on one.
They-
They will be moving, like wind only, they'll be moving from place to place. When they
Mhm.
don't sleep, you can see those people, working, just seeing some serials or something
Mm.
like that, web series or all those things, because not intending to, like update their knowledge even at that time, because they don't know what they're doing. That's why.
That's about it. So a racing body and a racing mind both need stimulants that can calm. Sometimes it could be through sources like maybe a good book or a walk, but sometimes a medication is required. If not, your kitchen remedies, home remedies, good diet always helps. In the series of depression and mental health well-being, we are talking to Dr. Ambika Nair, co-founder and chief consultant of Santhigram Group of Companies. They have online consultations also available. They have offices here in the tri-state and also across the globe, many locations in India too. Feel free to contact them. Complete privacy of your home, and all cases are confidential. We want to thank all our viewers for encouraging us to bring more and more episodes. Dr. Nair, your final word to our viewers regarding Vata-related depression.
See, sometimes, this constipation itself will make a very bad depression on them.
Okay.
So many things they will be using, so that it has to be treated very properly. We call it a cruda crosta, like a very, like a tiny, like a balls type, it will come.
Okay.
Okay. Sometimes it does not come. Even weekly once also people does not go. I have a lot of cases. That's what I'm mentioning that actually.
Okay.
So that we have to really, it is because they are very intelligent and high vata. They cannot stick. Okay.
That's
So,
true.
like such cases, if you have any chronic constipation and all, think that something is going to happen to your body.
Mhm.
So you have to understand what changes you are getting, whether it is lubricated, like very dry skin, hair fall, like dandruff, it's not going away. Okay, so these are all related with the Vata dosha.
Okay.
So take care of them.
Absolutely. Thank you, Dr. Nair. Friends and viewers, every time I talk to Dr. Nair, many conditions I do sometimes feel like I'm looking at Google or Wikipedia and I feel, oh, I can also take mark this. But after having a conversation with Dr. Nair, I am also feeling very grateful. And I start to realize that this body is such a beautiful gift and we are wasting our time on things which are just not necessary to be sticking to this body, whether it's thoughts or whether it's food. Let's encourage each other to bring more programs like this and encourage Santhigram and the entire team by like, share, and subscribing to the channel. And whenever a new program comes up, you are the first one to get notification. Thank you, Dr. Nair, for this episode.
Thank you so much.